Hi, this is Dr. Hazboun, and today I want to talk about how we do sizing for our breast implants. So a lot of considerations go into which implant we choose, and we start with the basic stuff. So we actually do some measurements before we decide on which implant to go with. The basic measurement is breast width. We use devices like this to measure the width of the breast. The reason is you don't want to have an implant that's too wide. In someone whose chest is not that wide, it would just show from the side and it wouldn't look good. After we measure the breast width, we go to which profile we want to go with. So it depends on what your goals are. If your goals are to have a better, fuller upper pole, then we might go with a wider implant because that one would fill out that area. So we go with a lower profile implant. An example is this low profile implant. So it doesn't give you a whole lot of projections, it gives you some projection, but since it's a little wider, it goes up to the upper pole and gives you some fullness. But if your goal is more projection and not necessarily care much about the upper pole fullness, then a higher profile implant, such as this one, might do the trick. So it might not give you a whole lot of fullness, a little bit of fullness up in the upper pole, but will give you a lot of projection. Once we talk about those two things, then we have to talk about what cohesiveness you want. The more cohesive ones hold their shape a little better in terms of you'll have less rippling. But for the touch, they might not feel as natural as the less cohesive ones. So it's a matter of preference. Would you rather forego the risk of rippling? You might still have some rippling, but there's less risk of it. Or if you want more natural feeling implants. Again, with less cohesiveness comes the fact that there's a higher chance of it leaking out if there's a rupture. But in general, with the newer implants, even the less cohesive ones, they're more gummy bear consistency. So there's less risk for a leaking out of the implant, even if it ruptures. Once we kind of come up with the implants that work for you, and we just kind of want to confirm how you feel with the size and like the volume of the implant, then we have our sizing kit, such as this one, where you can actually use those sizers inside a sports bra that we provide in order to see how it would look like. It might not be 100% accurate just because this goes on top of your breast, while a breast implant would go underneath the breast, but it would give you an idea of what to expect. And with all of that, we come up with the best implant for you and the best plan to go with. Whatever your concerns are and whatever your needs are, we're always happy to talk about it and to come up with a plan that better works for you during your consultation.